Bismillahirrahmanirrahim. Assalamu alaikum. Welcome everybody to the presidency and thank you so much for joining us today. Vaise I am used to speaking to large audiences, but I don't know why today's audience seems slightly more intimidating. It could be because we are here in the House of the Federation, the Presidency of Pakistan. Obviously, it's also the audience that sits before me. We have the might of Pakistani media, the cream of Pakistan's business community from all across the country, and of course, the diplomatic corps. I welcome you all. I thank you all for joining me, and I look forward to taking this opportunity to talk to you about the province of Sindh. It is my belief that we are a province that is often presented as a glass half empty in Islamabad. And through this presentation today, at the very least, I'd like to establish that we're very much a glass half full. And there's a lot more potential for us to unlock, hopefully, together. The Pakistan People's Party government in Sindh started in 2008, and as the Chief Minister mentioned, every subsequent election, the people of Sindh have entrusted the Pakistan People's Party with a larger mandate than before. The Pakistan People's Party's philosophy has historically been rooted in roti, kapra, makan. Food, clothing, and shelter. The idea behind this philosophy, I'm not ready yet, the idea behind this philosophy is fundamentally to address the issue of affordability. In a country such as Pakistan, where we have unemployment, poverty, but increasing income inequality, the Pakistan People's Party's approach to every sector across our government has been trying to invest in our institutions in such a way to allow our people the opportunity to afford the basic fundamentals in life. We inherited a government in 2008 that faced a multitude of challenges. We had the issue of terrorism and law and order. I'm sure our media friends and all of those here who've witnessed firsthand how when the Pakistan People's Party's government took over in 2008, obviously all over Pakistan, but also in the province of Sindh, we faced terrorist attacks on at least a daily basis, and in some cases, at least a weekly basis, in some cases, a daily basis. We faced religious extremism like the rest of the country did, but particular to Sindh, we faced ethnic tensions and frictions that would often result in violence. Our law and order challenges weren't confined to the city of Karachi alone, but across the province. We faced, even in the northern parts of Sindh, in Larkana, my hometown, before the Pakistan People's Party's government took over, we used to observe the anniversary of Shaheed Zulfikar Ali Bhutto every year in April. And our party used to have to go in convoys in order to provide our people the necessary protection in order to reach from across the province and across the country to Larkana. Similarly, whether it's our health infrastructure, our education infrastructure, I could go on about the challenges that we face. But after the Pakistan People's Party's intervention, we're proud of what we've achieved, whether it's law and order, whether it's education, whether it's public-private partnership. And I'd like to take this opportunity today not only on dwelling on our accomplishments, where we've come from, what we've achieved, and hopefully a little bit of where we'd like to go. I'm going to start with our healthcare sector. The Pakistan People's Party's approach has been that we believe that healthcare should be a fundamental right. That if the people of Pakistan, or if any citizen, cannot afford treatment, it should not mean that this is a death sentence. And we have invested over the course of 3 governments in setting up free of cost medical facilities and health infrastructure all across the province. And not only are our facilities that I'm just going to talk about free of cost for all our citizens, but also of international standards. I'm going to start by talking about Karachi's JPMC. Actually, before that, I'm going to tell you that we've invested over the 3 governments, and we brought up our health budget from 2.9% of the Sindh's budget to 10% of our budget. As far as Karachi's JPMC is concerned, it is our sort of the cornerstone of Sindh's health system. It's our biggest hospital in Karachi, and it was handed over to us after the 18th Amendment from the federal government. Along with other institutions across the province, the healthcare sector had suffered from neglect, from a lack of development, a lack of investment for more than a decade from when we came into office. And when we inherited the JPMC, our infrastructure was dilapidated. We had a capacity of 1,100 beds. And over the course of the Pakistan People's Party's government, we've now transformed this hospital in partnership with the people of Sindh, with the people of Karachi, with the philanthropists of Karachi, and as a result of heavy investment by the Sindh government into the country, one of the country's leading hospitals. We've added a 550-bed surgical complex and OPD, 120-bedded psychiatric ward and OPD, 110-bedded neurology ward, and OPD, top-of-the-line equipment. For example, we have the CyberKnife technology for the treatment of cancer at JPMC. This facility, again, in partnership with charitable organizations, the Patients' AIDS Foundation, we've not only made it possible for this top-of-the-line cancer treatment to be available in Karachi, but we're also the only facility in the planet to offer this expensive treatment completely free of cost. We've taken the JPMC bed strength from 2012, it was 1,100 beds, to now 2,208 beds. So we've doubled our capacity so far. If I just talk about JPMC's this CyberKnife and cancer treatment facility, we've served patients from 178 cities and 24 countries. And our CyberKnife facility and other tomotherapy and equinox sessions and all of this component, we've served 250,000 patients. It says here, now I don't know whether that's daily or monthly because it's missing in my presentation, but this is one of our most expensive treatments that we afford to our citizens, absolutely free. And I just wanted to highlight that while 46% of our patients, so less than 50% of our patients who receive this treatment are from the province of Sindh, 31% of patients who receive this treatment are from Punjab, 11% of the patients who receive this treatment are from Khyber Pakhtunkhwa, 7% of the patients who receive this treatment completely free of cost in the province of Sindh are from Balochistan, and 5% are international patients. that come to Karachi's hospital. So the JPMC that we inherited with 1,100 beds in 2012, we added our 200 bed in 2020. We added our 500 bed surgical complex. In 2020, we also added our food complex, which feeds 500 people daily completely free of cost. In 2024, we added our psychiatry and neurology department of 120 beds.